Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas. With me, as always, on a Wednesday morning is Bill Kearney of Northlake Medical Pharmacies. Welcome, Bill. And the big inauguration this weekend is getting everybody either excited or nervous or a little bit of both. And
yeah, I'm sure the anxiety is probably the greatest part of that. I would hate to be there. Not because I don't support the president-elect, but just the amount of tension of demonstrations and something going wrong, and it would be it's something that kind of terrifies me. I've never seen such negative tearing apart of an individual that was going to be president of the United States, and the support that a wide group of people are giving them. It's just an inflammatory situation that doesn't do anybody any good, whether you like the man or you don't like the man. He deserves a chance. Nobody deserves to be treated the way the liberal press is treating him, and I usually don't speak much about either side of the aisle here, but I'm talking about human beings now. And if we were to treat the incoming mayor or the incoming board of supervisors, the incoming sheriff in our counties the way these people are treating President-elect Trump, it would disturb me greatly, as this does. I wouldn't care if it was the other side and they were doing the same thing to the other party. I would just be just as unhappy about that. So there's a lot of concern, there's a lot of anxiety, there's a lot of hope from the people that you never hear about because the press doesn't report anything positive about this man. So
I was watching a show this morning before it came in. It might have been Good Morning America or something like that, and they were in Ohio and interviewing some people of Lake County, Ohio, which was kind of...
I saw that. It was on the Today Show.
The Today Show, that's what it was,
There were Mormons, and they said, yes, we don't support a lot of what was in the press about him, but we want to change, and we support America, we support him, and that was that was quite unusual for that network.
Yeah, and then one of the ladies, and this was kind of cool because my wife, she doesn't like Trump at all. She's a female and has some female views about how he treats other females, and her one of the people on the show said, "Look, we've got to stop dividing the country by asking, who did you vote for? At this point, it's irrelevant. We need to move forward. It doesn't matter who you vote for anymore. You need to get in and support the president." And my wife's like, that's actually a good point. So if my wife can change, maybe they all can change. Bill, I think we have a call coming in right now. Good morning. You're on Health Talk.
Hello. Are you guys on the air today?
We are on the air today. Are you not hearing us?
Yeah, I guess I got the back part of it. Are you guys taking calls?
Sure.
Sure, yeah.
Oh, is Bill there?
Bill's here, yes. Can you hear him?
Hi, Bill. You're such a good man.
It's been a long time.
I was going to ask Bill, I'm wanting to take some calcium, and I'm going to be 60 in a couple years, and I was wanting to ask Bill, what's the best recommended calcium for my age group?
Well, about 1,200 milligrams of calcium, which it comes in 600 milligrams of calcium, and then you can get the one with vitamin D with it, and that helps it absorb. So 2 of those 600 milligrams. Calcium carbonate is the least expensive, but it's the harshest on the stomach. So the other calcium that is 600 milligrams that has vitamin D in it is the kind of choice both for your stomach and both for the absorption of calcium. So it's females need about 1,200 and males need about 1,000. So it's a standard dose that shouldn't bother your stomach, and And you probably should have been taking it all along. I mean, it's
Yeah.
but you know, it's one of those things that you don't feel any different. You just, and then some people take magnesium oxide with it too, which helps the muscle cramps. But I wouldn't worry about taking excessive amounts. I would just take the 1,200 milligram and make sure it has vitamin D in it to help it absorb into your system, and take it once a day or twice a day if it bothers your stomach, which I don't think it will.
Yeah, and then another thing is somebody's telling me to have like steamed vegetables, like the dark greens, like broccoli and things like that, like steam the broccoli and eat a lot of dark green foods.
Well, as long as you're not on something to keep the blood thin from clotting, because those heavy green, and we're going to talk about that, believe it or not, today, about those green leafy vegetables and which ones have are good for you and which ones not to take high quantities of if you're having trouble with, if you're taking Coumadin or warfarin or something to keep your blood from clotting. Those things make your blood thicker rather than thinner. So, but any of those
I'll
green,
be listening.
any of those green leafy vegetables are good for you.
All righty. Okay,
Okay.
thank you.
Thank you for calling. We missed you.
Gentlemen.
Bye-bye.
Bye-bye. So we just as well get into it. This is Health Talk. Our number is 263-5252. If you have any questions about anything we're talking about or something that you want to talk about, give us a call. I have just a few little one-page things here that was kind of fun. I went to the New York Times yesterday, and I get a lot of health information from there, but I got some things that were just one-page things that I thought would be kind of fun to talk about. And one of the articles was "Eat Peppers and Live Longer." And I know, Paul,
I saw that one, yeah.
Your wife has been a hot food aficionado, actually, and and it's helped her lose weight. And this study was a new one that actually verifies findings from an earlier study of spicy food that was conducted in China in 2015. This new report used the data on American people. About 17,000 American men and women participated in a larger public health study. There were 4,946 deaths over the 23 years of study. And after they took out the variables for age and sex and smoking, high blood pressure, high cholesterol, diabetes, and other health and diet behavioral characteristics, they found those who reported eating hot peppers had a 13% reduced risk of dying early. Now, the kicker to this is they don't have any information about how many peppers or quantities of peppers that the people ate. So the study is just more of an observational, and therefore it's just a casual connection that can be proven. Still, they write the capsaicin, the substance that gives peppers their punch, has anti-inflammatory and antimicrobial properties that's linked to disease prevention. It's not enough to make somebody change their diet if they weren't eating hot peppery foods at that point. The professor of medicine at the University of Vermont who did the study says, don't smoke, limit calories, don't drink to excess, get a flu shot every year. Those are things that we have very convincing evidence that will help you live longer. We don't know how much chili pepper to tell you to eat, so we can't tell you that. But I love hot food, Paul.
Yeah, I do too.
My wife for Christmas got me, was up in Humboldt County and got me 100% hot liquid, and I cooked.
What?
Cooks,
Like just straight pure?
Well, it was a hot sauce, but I had no idea, so I cooked a pork chop on the barbecue, and I poured it on the pork chop instead of pouring it on a little piece to try.
Sure.
I've only used it once, and my son was down from Ferndale. And he works for a phone company up there, and I said, "Have you tasted this?" And he says, "Yeah." And it with Tabasco or some of these others, it kind of flavors the food. This was so hot that all you tasted was the pepper, and it kind of diminished the flavor of the food. But I do like hot foods and spicy foods. I was in Korea for about a year, and over there they eat very hot, spicy foods. In fact, you can. I was in a MASH unit up on the DMZ back during 10 years after the war, which there was a war still going on. You could get a bottle of Jack Daniels from the gate guards, and you'd hand them a bottle of Maalox, and they thought they had the better deal.
Oh, yeah.
So, they have a food called kimchi, which there's a winter kimchi and there's a summer kimchi. The winter kimchi is a cabbage thing that ferments for a long time, and they keep adding hot peppers to it. And then the summer cabbage is a lettuce-like thing that they eat, and they keep adding hot peppers to that until it's really spicy, and they develop a taste for that. So one of the other things in the New York Times was about getting older and sleeping less. There's some conflicts here because there's two kinds of insomnia. One is a primary insomnia that results from a problem that occurs mainly during sleep, like obstructive sleep apnea, restless leg syndrome, those kind of things, which can be disturbing to your sleep. And the other is a secondary to an underlying medical or psychiatric problem or the side effects of medication, behavioral things, exposure to caffeine, alcohol, nicotine, or daytime naps. And among many medical conditions that can cause insomnia are heart failure and GERD, esophageal reflux, lung disease, arthritis. As you begin to age, your bones and everything, if you've had as many surgeries as I have, when you get up in the morning, you just don't feel very good until you can get the lubrication going in your bones and have your heart operating more efficiently. So, but regardless of the reason, it can become a learned response when people kind of anticipate having difficulty falling asleep. We have this in the pharmacy all the time with people, especially the elderly or people over the age of 50 or 60, that just can't sleep anymore. Or if they do, they sleep a couple of hours and they can't get back to sleep. So the more you worry about a sleep problem, the worse it gets. So while on occasion you wake up in the early hours of the morning and can't get back to sleep, I usually get up and read, which takes the thought of the insomnia off. We have those projection clocks that go up on the ceiling, so when you look up and you see it's 2:50 in the morning, and then you wake up and it's 2:80 in the morning, and or 2:55, and you say, I'm not getting to sleep, and then it's 3:10, and you keep, it just keeps bringing back that thought. So you need things not to remind you of the fact that you're not sleeping. So non-medical causes of insomnia are usually successfully treated by practicing good sleep hygiene. That means limiting naps to less than 30 minutes a day. And I wonder if I ever retire, if that would be a problem for me. How do you, you get up in the morning and you have, like today, it's raining. I'm going to work. I'm driving to San Francisco after I get off the show. But if I didn't have any place to go or do, would I lay back down or turn on the fire and read a book or something and sleep for, I wonder about that. I wonder about when you don't have a reason to get up and do something, if in fact that would be a problem as far as taking a nap or something. Preferably early in the afternoon, and avoiding stimulants and sedatives, heavy meals, minimizing liquids within 2 to 3 hours of bedtime, and getting exercise, preferably in the morning. But if you still can't fall asleep within about 20 minutes, they recommend leaving the bedroom and doing something relaxing like reading a book. Many people think, well, I'll get up and have a good, strong drink. That will put you to sleep, but it won't keep you to sleep. And if you still need help with insomnia, there's behavior therapy that has proved effective in trials. Finding a specialist, though, in this part of the country may be pretty difficult to do. So Older people who are more sensitive to their side effects, including daytime hangovers, even short-acting drugs, can have side effects. And with a lot of the new healthcare laws, they don't want you to be taking anything that's a central nervous system depressant to your system, which is anxiety medication, sleeping medication, antihistamines that are sedating, those kind of things. And along that line, one of the things that came out when I was going through finding information was the benzodiazepine use and risk of developing Alzheimer's disease. Benzodiazepines are things like Ativan and alprazolam, which is Xanax, and Ambien, any of those central nervous system depressants. And there was a study conducted to analyze the relationship between previous use of those kind of drugs and the risk of Alzheimer's disease. And although I didn't get the results of the study in numbers, it revealed that the benzodiazepine use was not correlated with the increased risk of developing Alzheimer's disease. Now, it wasn't long ago that I talked to you about the taking of diphenhydramine or Benadryl, and what the risk was in taking as little as 16 milligrams a day of diphenhydramine. And most people that take it take a minimum of 25, usually 50 or more, and it is very much related to the increase in dementia and the increase in Alzheimer's disease, and that's just an antihistamine. But it isn't chemically related, structurally related to a benzodiazepine. And one thing that we've heard a lot about, and I kept not reporting this because it seems like every day we talk about it, but it just kept coming back, and that was the benefits of daily aspirin outweigh the risk to stomach problems. And these are, if you've listened to me through the years, you know that I talk about risk versus benefit. If the benefit outweighs the risk, then you should take it. If the risk is greater than the benefit, then it's pretty marginal. It's up to you and your physician whether or not you want to take it or not. But stomach bleeds caused by aspirin are considerably less serious than the spontaneous bleeds that can occur in people not taking the drug. So the extensive study of literature on aspirin reveals that while regular use of the drug increases the risk of stomach bleeds by about half, there's no valid evidence that any of those bleeds are fatal. So with, in this study, showing that there was no increased risk of death from stomach bleeding in people who take regular aspirin, they kind of hope there will be a better confidence in the drug and wider use of it by older people. I have not been told by a cardiologist or an internist to take an aspirin a day, but at night when I go to bed, I do, and I take half of a muscle relaxant. I take an aspirin at the same time, and I take a real aspirin, not a small milligram, 81 milligram one. So we hope that people will be less afraid of taking it throughout the country. Heart disease and cancer are still the leading causes of death and disability across the world, and research has shown that a small daily dose of aspirin can reduce the occurrence of both diseases by around 20 to 30%. So low doses are given to patients with cancer alongside chemotherapy. And
looks like we both have cell phone issues going on. Mine just beeped and yours started playing a song.
I never get a call. So anyway, just in getting rid of the information, it's effective additional treatment, reducing the deaths of patients with bowel and possibly other cancers by 15%. This is a trial that's been done many, many, many times, and the results are coming out the same. So not to be any more concerned about it than we have in the past, because the bleed that develops isn't any different than the bleed develops taking non-steroidal anti-inflammatory. So along what we were talking about before with President-elect Trump, we want to know Eventually, when he takes office, will he walk the walk? Will Trump lower drug prices? That's a main issue for people in my business. And President-elect Trump had told Time magazine he doesn't like what's happened with drug prices, and he has shown a great deal of interest in that even since he won the election. But what we think about is, can he actually lower prescription costs? The drug makers must think he's bluffing, because they begin jacking up prices as the 2017 took its first breaths. CNN Money reported a 9.5% increased price hike for the multiple sclerosis drug Ampyra, and Bristol Myers increased the cost of its arthritic drug by 6%. So according to the data supplied by OptumRx, the average price of 50 of the most popular generics increased by 373% in the last 4 years. Mylan, which is the one that had the EpiPen, led the race to the bank, being the worst offender by raising the price of EpiPens by 548%. So what would Trump do? As a perceived wheeler-dealer businessman and non-politician, he might succeed in lowering the prices. He promised giving Medicare the power to negotiate with drug companies, which is illegal at this point. The legislation that created Medicare and Medicaid denied the agency's ability to negotiate prices. So without naming the numbers, the Congressional Budget Office has stated that there's some potential for savings if the price for unique drugs were brokered. So if Trump can offer drug manufacturers some corporate tax breaks without insisting they make their pricey prescriptions here at home instead of overseas, they may be game to lower prices. Now remember, what we've talked about in the last 3 or 4 weeks is the major part of raising prices has not been the drug companies in the final result of what you get. It has been the pharmacy benefit managers, which are people like Caremark and the United Healthcare and OptumRx have been the people that have taken the extra part of decreasing the drug cost, but increasing the amount of money that pharmacies have to pay back to them. So we're hoping that there is some success. At least there will be a real attempt to get drug prices to be decreased in the future, and we're hoping that there is a new approach to that, which is going to help us get through the next 4 years at least, and then maybe I'll be retired. So we're going to take a break, and when we come back, we're going to talk about 4 combinations of drugs that can cause a problem when you combine the two. Hi, I'm Bill Kearney from Northlake Medical Pharmacy. Recently, I visited Mrs. Goodwin's 3rd grade class at Lakeport Elementary School to answer some of the students' questions about their health. Here's what they had to ask.
Why do I sneeze a lot when I'm around tall grass?
That's because you have a grass allergy. Your body is trying to get rid of the allergen or the pollen in the grass that makes you sneeze. You may also get itchy eyes and runny nose because of the allergy. Northlake Medical Pharmacy, a good neighbor pharmacy, is offering a Healthy Kids free vitamin program to the kids of Lake County. Any child aged 2 to 12 can receive a free 30-day supply of children's chewable multivitamins every month for a year. Simply sign up your children at either of our 2 locations at 347 Lakeport Boulevard in front of the Bruno's Shop Smart. Call 263-1328. Or at 5136 Hill Road East across from Sutter Lakeside Hospital. Call 263-6192. The Healthy Kids free vitamin program at Northlake Medical Pharmacies.
They're good for us.
You're a 19-year-old kid critically wounded in the Central Highlands of Vietnam. Your unit is outnumbered 8-1, and the enemy fire is so intense that your CO has ordered the medevac helicopters to stop coming in. Your family is halfway around the world, and you're thinking that you'll never see them again. Then you hear the sound of a helicopter. Captain Ed Freeman is coming for you. He's not medevac, but he heard the radio call and decided to fly down into the machine gun fire anyway. Then he flies you up and out to safety, and he keeps coming back 13 more times until all the wounded are out. No one knew until the mission was over that the captain himself had been hit 4 times. Medal of Honor recipient Captain Ed Freeman died in Boise, Idaho. We're losing about 285 Vietnam veterans every day. But the Education Center at the Wall will preserve stories like these so future generations will understand and never forget. Call 1-866-990-WALL or go to buildthecenter.org and help us build it.
Okay, here are 3 important reasons why your son or daughter should play a sport in high school.
Number 1.
High school sports teach valuable life lessons like self-discipline and time management skills.
2.
Teens who play a high school sport have better grade point averages.
And number 3.
High school sports are safer than ever before.
This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
I wanted to be in the military since I was a kid.
I served in the United States Air Force.
I served a total of 16 years.
I was deployed 13 times.
On my second deployment, 4 bombs hit my vehicle.
And at 19 years old, that's the first time I ever saw somebody die.
Coming back, I was raging.
I started having pretty horrible nightmares.
I would wake up in the middle of the night, sweats.
I started drinking a lot.
I felt worthless.
I guess I never recognized it in myself.
Eventually, one day I just walked into the VA hospital and said I'd like to see somebody.
Don't suffer alone. You gotta find that link with somebody that'll make you let it go.
It all starts with going to the VA. There's a whole community of veterans that just want to help you out.
It's for the guys who couldn't come back, so you owe it to them to live well, because they're not here with their families.
Visit maketheconnection.net.
All right, we're back.
Well, when I planned on and going over this a few days ago, I didn't realize it was going to be on the Today Show or one of these shows, but it was about 4 combinations of drugs and foods or something similar to that would cause a problem. And the first one is blood thinners and leafy greens, and we were talking to one of our loyal callers at the beginning of the show, and blood thinning medications like warfarin that help treat and prevent blood clots, which work against vitamin K rich foods. And these are foods that green leafy vegetables that are really healthy for you: kale, broccoli, Brussels sprouts, many more packed with vitamin K, which is helping our blood clot. The solution is, if you're on a blood thinner medication, limit your daily servings of foods with vitamin K. Some healthful substitutes with low levels of vitamin K includes beets, turnips, pumpkin, squash, sweet potatoes, and tomatoes. These, I have told people that go on warfarin or Coumadin at the time what these drugs are, and if you go to take a ProTime, the day after you've had an abnormal amount of any of those vegetables, your ProTime will be changed considerably, and they will likely increase the amount of Coumadin or warfarin that you're taking because of that high vitamin K content. So be aware when you're doing your ProTime whether or not you've had a diet like that, and let your doctors know. Another one is ACE inhibitors and bananas, and this is like Lotensin or lisinopril. Those are taken for high blood pressure and heart failure. They're used to lower blood pressure or treat heart failure, and the way they do that is they keep a substance from being chemically produced called renin, which causes the blood vessels to constrict. So these work by relaxing the blood vessels, allowing the blood to go wherever the heart can pump it better without causing the heart to increase in pressure. So if you're eating a lot of bananas, the increase in potassium can cause irregular heartbeats and heart palpitations. The solution in this case is to avoid large amounts of foods high in potassium, which also includes oranges and salt substitutes when on these medications. A salt normally is sodium chloride. When you use a salt substitutes, it's usually potassium chloride, which is what is causing that problem. And we would, there's what they call ACE inhibitors, and there's ARBs, which are ACE inhibitors. And lots of times in the beginning of having these drugs on the market, a physician would prescribe both of those. Well, number one, it's called duplicate therapy because they do the same thing, but they work differently. And the other thing is they would be supplemental potassium on top of that. So the ACE inhibitors and the ARB was causing potassium to accumulate, and then they were giving them extra potassium because they were on Lasix or something similar to that. This one's an old one that used to only be for a couple of antibiotics, and now it's changed, and it's antibiotics and dairy. The antibiotics are prescribed to fight infection or to prevent infection. Doctors always remind people to finish the whole course, even if you start feeling better, to kill the cause of the infection completely. We just told you a couple of weeks ago that that is changing, that people are finding out because of the resistance developed to all the antibiotics that maybe a 5-day therapy can be a 3-day therapy. We also already have drugs like azithromycin or a Z-Pak where you take 2 tablets the first day and then 1 a day for the next 4 days, and that eliminates having to do a 10-day therapy. So, but when you're on antibiotics, having dairy products such as milk or yogurt and cheese can delay or prevent the absorption of tetracycline, which is the one that's been for years, and ciprofloxacin, which is Cipro. The calcium binds to the antibiotics in the stomach and the upper small intestine and making it harder to absorb. So take your antibiotic 1 hour before or 2 hours after a meal, and never take ciprofloxacin or tetracycline with a glass of milk. In tetracycline's case, it not only slows down the absorption, it stops the absorption. So we used to give tetracycline all the time to teens that were having acne problems, and it was quite effective, but lots of times they would take it with milk, and then it wouldn't absorb into the system, and it wasn't working. So many times they would increase the amount of antibiotic and not even address the issue about milk or those kind of situations where the milk would be a problem. And this one I had not heard before, or if I had, I hadn't heard it for a long time, and it's non-steroidal anti-inflammatories, which is like ibuprofen and naproxen and garlic taken for pain. Both the non-steroidal anti-inflammatories and the garlic may increase the risk of bleeding. We know the non-steroidal anti-inflammatories do. Garlic can reduce your blood clotting ability, and garlic products can cause bleeding in rare cases. Other prescriptions may increase this effect, excuse me, resulting in the increased danger of bleeding. I am not going to tell you you have to avoid garlic when you're taking non-steroidal anti-inflammatories, although there is some data that says it, but it is a very small percentage. And it's something that if you have a tendency to have gastrointestinal bleeding anyway, you probably should be on something that diminishes the acid if you have to be on a non-steroidal anti-inflammatory. So something like a inhibitor for acid production. So this one you're not going to like. Chemists have bad news about your cough syrup. Excuse me, I'm not drinking cough syrup, I'm drinking water. For years, we have said cough syrups are better for you if you're having a problem, and there isn't a medicine cabinet that didn't have cough syrup in it with good cherry-flavored cough syrup, or at least that's how it feels during cold and flu season. But does the stuff even work? In many, many tests, cough syrups perform no better than a placebo in many studies. This is a little amazing. The one known benefit, they can make you drowsy and help you sleep. Now, we have prescribed and sold over the counter many, many times Robitussin, which is guaifenesin, which is an expectorant to break up the mucus in your lungs, and has been very effective to the best of our knowledge. and especially if consumed with extra water. There are products on the shelf, Mucinex is one of them, that is the same drugs with dextromethorphan in it that have been very effective in this cough that's developed with this viral flu or viral cold that's gone around, where there's a lot of congestion and a lot of coughing. So I'm not sure what the difference is between it being in a liquid form and a solid form, but in the people that we've recommended the tablets to, it's been very effective. But as far as cough syrup, and of course if you've gone in lately to get a cough syrup for your 2-year-old or 3-year-old, you won't find it anymore, because anybody under 4 years old is considered too young to be taking it, and it's not effective. And many of them have sedative properties which cause you to be drowsy, and you don't want to over sedate your young child. So we're learning all the time things that we thought was good forever. We remember how many times we told people to take estrogens for calcium replacement, and had people taking large amounts, and now we've reduced that amount to about 1/10 of what it was. And we found out that people were more susceptible to strokes and heart attacks, females, when they were taking it. For years and years and years we said to take it. So as we get more and more experiments going on, and if you remember, the main reason for not having a lot of data on females was we weren't studying females' reactions to medications until 1994, and that was the first year of the Women's Health Initiative. We started including them, and we found out that gender prescribing was prevalent, or should have been, because men react different than women to the medications, and there was medications that act differently in females at a reduced dosage compared to what a male is, and vice versa. Coming up on the 28th of January is a Saturday. There is hospice is putting on an end-of-life options seminar. It's a workshop actually for Lake County residents that are interested in learning more about the new law and discussing in-depth considerations of End-of-Life Act as an option for themselves or loved ones. So if you go to this, you'll hear how the End-of-Life Options Act is being implemented, and perspectives from professionals sharing information on important issues, religious and ethnic conversations, family dynamics, communication with family members and loved ones. No cost for the workshop, and the light lunch will be provided. And if you want additional information, you can call Kathleen Bradley at 263-6720, 263-6720, extension 123. It's going to be at the hospice's building on Parallel Drive, January 28th from 10 a.m. to 2 p.m. We've seen a great amount of change in this bill since it was passed by the state of California. We had worked very hard to get this bill passed, and then we found very little acceptance of the bill because people were afraid of it. And because it's quite lengthy in what they were doing, and in recent months this option has become available to a growing number of Americans, and last June it went into effect here. In November, Colorado voters approved a ballot by nearly 2/3 of majority, and it was already legal in Washington, Vermont, Montana, and Oregon. So the laws are all based on death with dignity, adopted in 1997, and will allow physicians to write prescriptions for lethal drugs when patients qualify. And lethal is something that will end your life. The somewhat complicated procedure involves 2 oral requests, excuse me, and a written one, with extensive discussions and approval by 2 physicians, and patients must have the mental capacity to make these medical decisions. That process took shape in Oregon 20 years ago. The culture and political context surrounding it has changed considerably. The state's recently considering the issue different from the early adopters. One of the problems in this bill being passed is the drugs that are to be prescribed have done what other drugs have done, and as they were very inexpensive in the beginning, they have raised the price of these drugs, and now they are extremely expensive. States can opt out of provisions allowing any individual or institution to decline to provide prescriptions. In California, Catholic healthcare systems have opted out predictably, but so have a number of others, including Vitas, which is a hospice chain. Moreover, California hospitals and hospices can forbid their affiliated physicians to write those prescriptions. That's not the case in Lake County. The shortage of providers has led to a lot of patient and family frustration. They had the expectation that would be available and happen seamlessly once the law went into effect, but there's a lot involved with this law. Sometimes when patients have waited until late in their illness, they die before they can become eligible for assisted death, or they become too physically or mentally incapacitated. So in areas where many providers opt out, very sick patients may have to travel long distances. Most insurers in California do pay for doctor's visits and the drugs, but Congress has long prohibited the use of federal dollars for aid in dying. Congress has not changed so far, so Medicare and the Department of Veterans Affairs will not cover it. Cost mattered less years ago when a lethal dose of barbiturates ran $100 or a couple $100. But as soon as California introduced their law, the most commonly used drugs patients insures that will not cover the dying face, not cover aid in these cases, is $3,000 to $4,000 for the drug. Valiant, which has denied the suggestion, was exploiting the new law. As a result, physicians are turning to alternatives. What used to be very simple for us, when you went through the necessary procedures, we would get a prescription, the physician would write a prescription for 100 pills of secobarbital or pentobarbital, which used to be less than $100. The patient was then to open up 100 of those capsules and put them in a water glass or glass with whatever vehicle they chose, and take the whole 100 capsules in suspension in 4 minutes. And the reason there was a time limit was because this drug, since it's in a liquid form, gets in the bloodstream immediately, and if they don't drink it quickly, they'll start having side effects and they'll be incapable of taking the whole thing. So despite these obstacles and disappointments, the staff with compassion and choices that tripled since 2008 and an annual budget that nearly quadrupled to $16.9 million is eyeing its next target. So over several years, the leaders think they can help legalize aid in dying in Maryland, Hawaii, and New York. The number of residents taking advantage of the laws in Oregon and Washington has climbed in the past 2 years, but still after nearly 20 years in Oregon and 8 in Washington, fewer than 1% of deaths result in that. So I think this seminar or educational workshop that hospice is going to have would enter and actually give you a lot of information that you need. Now, the last people that you think would be involved in this is hospice, because they're all about comfort when you're dying. And when you're ready to have your life end and you have to go through procedures like this in order to do it, you would think hospice would not be concerned with this. But in Lake County they are. I went to a meeting in Santa Rosa approximately 6 weeks ago, and the physician that was there also was a hospice physician, and he was promoting pharmacies getting involved and people getting involved also. So over the course of the day, when people say their goodbyes and then withdraw to leave, they drink the Seconal or phenobarbital solution and swallowed it. No simple task with someone with advanced cancer. So you lose conscious almost immediately and die within several hours. So it's just a way of life. You know, things are changing. Politics are changing. Healthcare is changing. The way we address life and death are changing. So we need to be very much aware that those issues are there and they are an option in Lake County. They said they will have information from pharmacists. I wasn't requested to be present during this, so I assume that I won't be there. But it's an educational thing for a lot of individuals who are thinking about that as we enter that part of our lives, which we realize we're lucky to have 20 years left, and who knows, in 20 years from now people might be living to 120 instead of 85. So it's something, again, it's called the End of Life Options Act, and it's a workshop by the Lake County Hospice Services. It's Saturday, January 28th from 10 to 2 at the Hospice Services Center on Parallel Drive in Lakeport, and a small lunch will be served. We just finished our last flu shots. We're out now. We can't get any more. We immunized around 300 people or so at each location, and there's a big issue now with the change in leadership about vaccine safety, and President-elect Trump has brought on staff one of the Kennedy brothers to talk about whether vaccines are safe or not. And, you know, we always hear about, you know, why do babies have to take hepatitis B? You know, it's usually transmitted by people who are sexually active or by drug use. And the reason is that it's a very effective vaccine, and it protects you from the beginning of life until the end of life. There's this issue about vaccines with mercury in them, thimerosal, and allergic reactions. Some worry about that mercury, which occurred in very low concentrations, and it's only in a couple of vaccines now. And eventually it will be in none of them. But like vaccines, like any medicine, may cause side effects, but most are usually minor and short-lived. For example, giving a shot, some children will complain that their arms feel sore and experience a slight fever, and that may happen because there's a discussion on how many shots to give a child with the schedule they have now. What about vaccines that are no longer in this country? We found out by not giving polio and not giving measles, they came right back. So why not strengthen, you know, your natural immunity that way and not rely on other sources to get your immunity up? So, and the reason is, as an individual, we all have different diets, we all have different time schedules, we all live in different homes, we all have different ways, and when you leave it up to each other to protect yourselves, and it's not mandatory like it is in the state of California, it probably doesn't get done. And then we have people that are actually, excuse me, in fear of immunizing their children because they think it will give them autism or some other kind of immune disorder, and there just isn't any evidence to support that. So we have one of the strongest vaccination laws in the United States, the state of California does. I would advise you as a grandparent or a parent or a single mom or single dad to keep your kids on the vaccination schedule and have them get their immunizations. It's very low risk. Maybe it's uncomfortable, but it's uncomfortable for an adult to get a lot of shots at one time. We have to choose the schedule we're on when it comes to adults. We can only give one live vaccine at a time. We can give 2 vaccines. We can give you the flu vaccine, which is a inactive vaccine, and we can give you a live vaccine like pneumonia or Zostavax at the same time, but we can't give you 2 live vaccines at the same time. So just keep in mind that we're still, even though the flu season is over, we're still giving immunizations. You do not need a prescription if you need a tetanus shot, if you need a Zostavax shot, and you may think that Zostavax isn't covered on that's the one for shingles, on your insurance. We ran one yesterday that was $79, and it's normally $220. So even if you have a deductible, a lot of the deductibles don't make any difference when it comes to preventative medicine. So at least come in and find out if, without having to have a physician's appointment, that you're eligible or you need that shot. We will certainly take care of that for you. Just remember that's a venue that's available to you. I know the weather is starting to turn rough again out there. Remember that we have delivery services to Lakeport, Nice, Lucerne, Upper Lake, Kelseyville, the Rivieras, Buckingham. Just let us know a day ahead of time. Transfer your prescription over if you're someplace else, and we can get you the prescription the next day. No charge. It's a free service, and we'd be more than happy to help you. We don't have a lot of time today to get into how to cut your health care costs, but we'll talk about that next week. I'd like to remind you we're Northlake Medical Pharmacies with 2 locations for you. At 5136 Hill Road East across from Sutter Lakeside Hospital, call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard. Come see us there and call us at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday at 10 a.m. for Health Talk on AM 1270 and 96.5 FM KXBX Lakeport.